Central venous pressure monitoring, defined as the pressure of the blood measured in the millimeter mercury in the thoracic vena cava before the entry into the right atrium. Central venous pressure is determined by the function of the right heart and the pressure of the venous blood in the vena cava, so that this reading may reflect the function of the right side and the amount of blood volume and fluid status in the body. This pressure measured in superior vena cava via catheter placed in the jugular or subclavian vein. As we said, it reflects the pressure in the right atrium and provide information about the intravascular blood volume and the right side function, especially the right ventricular function. The purpose for central venous pressure monitoring: to monitor the central venous pressure, vascular axis عفوا. والمقصود بالvascular axis that we can provide medication or fluid. Also could be used as access for pulmonary artery catheter. For therapeutic uses, as we said, we can provide a medication or a fluid through this catheter. Catheter insertion: simply explain the procedure to the patient, obtain informed consent, obtain baseline vital sign and during the procedure. Emergency equipment and IV access should be available also. Consider sedation if restless or uncooperative patient, and follow surgical aseptic technique. We have to turn off the nasogastric tube or the link to suction. May we put the patient on Trendelenburg position, in which the legs elevated higher than the level of the head to promote the venous return, to clearly visualize the jugular vein in order to insert the catheter more easily. Flush the lumen catheter. مداخل الكاثيتر اللي راح ندخلها في السبكليفيان of a jugular vein لازم نعملها flush before insertion. Then we have to check for blood flow, then flush with normal saline. Keep the IV fluid isotonic until chest X-ray done and document the position. Document the date, time, name of operator in patient chart and label on dressing. Under sterile technique, catheter inserted via subclavian or jugular vein and the catheter placed in vena cava closer to the right atrium، لكن ما بندخل الكاثيتر باتجاه الرايت atrium. The hemodynamic monitoring purpose: the catheter connected with the system tube as in arterial pressure monitoring. Then the central venous pressure waveform will appear on the monitor. تقريبا نفس تركيب اللي شرحناه في الارterial blood pressure monitoring device. In this picture, the central venous catheter inserted in the subclavian vein, and this catheter has two lumen, one lumen for insertion of medication in yellow color as example, and the blue color for IV fluid, and the catheter inserted in the superior vena cava just before entry to the right atrium. ما بندخله للرايت atrium. Sometimes may we use the femoral vein to insert the catheter from femoral vein, but it's longer than in the inferior vena cava just before insertion to the right side of the heart. The complication for the central venous pressure is infection at insertion site, erythema, fever, increase in white blood cell. We can look for the culture. Dressing: IV tube changing, sterile when insertion, gloves, mask, gown, head cap, and etc. in order to avoid any infection. Thrombosis, small one can be flushed, but large one should not be flushed. The large thrombus may lead to the absence of the waveform. راح تختوي في الwaveform على المونيتور and inability to infuse the fluid or to withdraw blood. Treatment: aspirate the clot. In severe condition, thrombolytic therapy could be used. Air embolism due to the disconnection of catheter from the IV tube. 10 to 20 cc of air symptomatic, becomes the patient may present with different symptoms like confusion, lightheadedness, anxiety, and unresponsiveness.